Hello everyone, I am going to start the part 2 of anatomy of pulp cavity and its preparation. Corneal access cavity preparation. Access is the first and most important phase of non-surgical root canal. A well-designed access preparation is essential for a good result. It refers to the part of cavity from occlusal table canal orifices. For more precise definition, the objectives of coronal access preparation is to provide a smooth, free-flowing tapered channel from orifices to the apex that allow instrument and irrigants and medicaments to attempt cleaning and shaping of entire length and circumference of canal with as minimum loss of structural integrity to the tooth as possible. What are objectives? To remove all caries when present. When you see your conservative tooth preparation, just divided into initial and final cavity tooth preparation, so the entire caries is not removed initially, and it is final cavity stage where you remove entire caries. Second one is to conserve sound tooth structure. Third one is to unroof the pulp chamber completely. Fourth one is remove all coronal pulp tissue. Fifth one is to locate all root canal orifices. Sixth one is to achieve straight line access to apical foramen. Armamentarium for access cavity preparation. Mouth mirror, aerator, slow speed rotary handpiece, burrs which include round carbide burr number 2, 4, number 6 for caries removal and defining the external outline shape. Diamond burrs with round cutting ends. Fissure carbide burr, diamond burr, round diamond burr for entry into tooth. Extended long shank burr such as Muller's burr, Allen burr, endodontic spoon excavator, endodontic explorer, example DIG 16. Preoperative radiographic assessment, mesodistal tilt of the tooth, size and shape of the pulp chamber, thickness of the root of the pulp chamber, presence of the pulp stone, variation in the number of canal or roots, extent of the root and canal curvature, radiographic changes in the furcation and periradical region. Clinical consideration, complete removal of the carious tooth and other restorative material. Complete deroofing and removal of dentinal shoulders. The overhanging roof of the pulp chamber misdirect the instrument, which result in ledge formation in the canal. Hence, complete deroofing must be done to obtain unrestricted access to the canal. Removing the roof completely from the pulp chamber will bring canal orifices into view and allow immediate access to each orifices. Removal of the dentinal shoulder present between root canal orifices will help in achieving straight line access and improve the clinical access to the root canal. Krasner and Ranko's law guideline of access opening, which is given in 2004. The CEJ cemento enamel junction, which is the most consistent repeatable landmark for locating position of the pulp chamber. First law is law of centrality. The floor of pulp chamber is always located in the center of the tooth at level of the CEJ. Law of concentricity, the wall of the pulp chamber always concentric to the external surface of the tooth at level of CEJ. Third one is law of cemento enamel junction. The distance from the external surface of the clinical crown to the wall of the pulp chamber is the same throughout the circumference of the tooth at the level of CEJ. Law of symmetry, except maxillary molar molars. The orifices of the canal are equidistant from the line drawn in the mesiodistal direction through pulp chamber floor. Law of symmetry. The orifices of the canal lie on a line perpendicular to a line drawn in a mesiodistal direction across the center of the floor of the pulp chamber. Law of color change. Enamel white in color, dentin yellow in color, floor of pulp chamber gray in color, root canal orifices dark gray or black in color, pulp stone is white or dark yellow in color. Orifices 1. The orifices of the root canals are always located at the junction of wall and floor. Law of orifices location 2. The orifices of the root canals are always located at an angle in the floor wall junction. Law orifices location 3. The orifices of the root canal are always located at the terminus of the root development fusion line. What is mouse hole effect? If the lateral wall of the cavity has not been sufficiently extended and pulp or position of the orifices still remain in the wall, the orifices will have appearance of mouse hole effect. This feature occurs due to extension of canal orifices in the axial wall. By extending lateral wall of the cavity, thus removing all intervening dentin from the orifices, the mouse hole in the wall will be eliminated and orifices appear completely on the floor. We have done armamentarium for access cavity before. Number 2 burrs is used for maxillary anterior teeth and maxillary premolar incisal pulp horn area of maxillary anterior teeth. Number 4 burr is used for maxillary anterior teeth and maxillary premolar mandibular premolars. Number 6 is used for molars. Number 1 is used for floor of the pulp chamber. Long shank number 701558. Transmitter burr full crown inlays. Explorer is used DG16 JW17. DG means David Green. JW means John West. It is used to locate the canal orifices. Ultrasonic tips used to remove dentin and expose orifices.